So I'm Helen from Castle Vets in Launceston, and today we're talking about four important infectious diseases in cattle, TB, Johne's, BVD and lepto. And TB we're discussing at the moment. So we've talked through the lesions and the reactors. So one of the big important points of TB is that a lot of the decisions in terms of the control of the disease are out of the control of the individual farmer, because it's something that the government has control of. You can't make decisions on testing, on vaccination, on control in the way that you can with other diseases. Now that contrasts greatly with BVD, which I can't remember who had BVD. You got BVD? Yeah. Yep. So BVD is a disease that every farmer could control now. We have everything that we need at our disposal to control it well, because we have good, reliable tests and we have good, reliable vaccines. Now, have you all heard of BVD? Yeah. Now, the important thing about BVD is the carrier animal. Now, an animal that's a carrier is always born a carrier. It can't become one later in life. So the real important thing in terms of spreading BVD are these carrier calves that are born. And they're born with virus in their blood, and they're excreting virus and infecting everything that they're running with every day of their life. Now, carrier calves are produced in two different ways. One is if you've got a carrier cow will always produce a carrier calf. Now, we have a brilliant test in dairy herds where you can find if you've got a carrier cow, because you can do a bulk milk test, and as long as there are fewer than 300 animals contributing, it will tell you if there's a carrier within the herd. Now, you have to be aware of any cow that was dry at the time, or her milk was out because of mastitis or what have you at the time. But of those that contributed, you can find out immediately whether you have a carrier amongst them. Obviously, if it comes up positive, it doesn't tell you who the carrier is, and you have to go and do further tests in order to establish that. Now, the other way that you can have a carrier produced is if you have an animal that has never met BVD before, that meets it for the first time during pregnancy. And if they meet it at the critical time, somewhere between 30 and 120 days, then the calf is infected with BVD and it is born as a carrier. What happens is the calf comes across BVD before its immune system has fully developed, and so it thinks that the BVD virus is normal. It doesn't know that it has to react to it and try and get rid of it, because it's always been there. And so the carrier calf produced out of this cow that has met BVD at the wrong time will account for more than 90% of the carriers that are born. And that part can be controlled by vaccination. So you can't stop. The only way to stop these carriers born is to find which cows are carriers and get rid of them. But you can prevent these carriers being born by vaccinating your herd. So the BVD test is very, very reliable. And if you test a calf once at birth and discover that it's not a carrier, it will never become one. So it is possible for everybody to test and vaccinate their animals and adequately control BVD. It's our job to continue to try to convince people why that's important. There are various attempts. There are countries and regions who have eradication schemes and have eradicated BVD successfully. There are various other schemes that are in the pipeline. What would be really nice is if there was some cooperation and you had big regions or the country doing it. We have everything that we need to be able to achieve that. Now, BVD is important in two ways. Animals that are carriers typically don't grow so well as the remainder of their group. Now, this is a picture of 5 animals. They're all the same age. Now, you don't have to be very clever to be able to pick out this one hasn't grown as well as the rest. Now, and this one is a carrier. What is going to catch you out is that this one is too, and it looks just the same. So that's where the testing comes in, is to try and find this one. We can all find this one, but we can't pick out that one by sight. There are different strains of BVD, but there is predominantly one strain in this country. So most people would have the same strain. The second strain is more severe, but thankfully in this country is a lot less common. So if you've got a PI, that individual animal is likely not to grow very well. And for that individual animal, that clearly has a consequence. But the effect that it produces, the biggest financial loss to you, is the fact that this animal, every day of its life, is infecting all of its friends with BVD. And BVD attacks their immune system and makes them more susceptible to any other disease that's going round. So they're diverting more of their energy than they should be to dealing with normal everyday bugs. So pneumonia, scour, anything that might be going round. And as a consequence, none of them will grow to their full potential. So clearly they're nothing like as bad as this one, but they would all have put on more weight if this one and this one weren't there. So a big advantage to finding these animals and getting rid of them, and then longer term controlling BVD in your herd, is that you get increased growth rate and just better health in your calves. And lots of people have commented on that. Lots of people went into BVD vaccination because of the effects that it has on fertility, and as a consequence happened to notice that their calves were a lot better. So this is often the thing that made people do it in the first place, is that if the cow comes across BVD during pregnancy, we've already discussed if she meets it in the middle of pregnancy, she produces a carrier calf. If she meets it early on, then it'll kill the embryo. This is an embryo that's been killed by BVD and an embryo that's healthy at the top. If they meet it at the end, then they'll abort. Now, if they meet it at this stage, you probably won't know that because it's very small and you may never have known that the cow was in calf, she just returns. Obviously, if they abort later on, then that's much more obvious. So lots of people went into BVD vaccination because of these fertility effects, but found as a consequence that their general health of the herd was better. So really, the message with BVD is that it's a very expensive disease that is not always immediately obvious. If BVD gets into your herd for the first time and nothing's met it before, then it is very obvious. For most people, it's very common and it's there every day causing these effects, and it's not until you vaccinate or test and deal with it that it becomes apparent the problems that it was causing in the first place. There's a lot of evidence to show that herds that are living with BVD produce worse results than herds that have got BVD under control. So there's very strong financial evidence to say that it's sensible to do something about it. Okay.
As far as a beef herd's concerned, there would
Yep.
have to be a blood test on
It would have to be, I mean, you could, the milk test would work in the same way, but clearly there are additional hazards in collecting the sample. But yes, the most common way is to blood test. There are several different tests available that you use at different stages. There are even ear notch tests if you come across the ear tags. So you buy your normal ear tags, but you buy an adapted sort that collects a sample of ear tissue and you send that away. So you tag your calf in the normal way, collect the ear sample tissue and send it away, and it will tell you whether the calf's a carrier. So that's a good one. If you're going to blood test, then the cheapest way of doing it is it's possible to blood test for virus on pooled samples. So you can actually, different labs will pull different numbers of samples together, but the best deal I'm aware of is you pull 30 and you pay, I'm not sure exactly, £30-40 in that region for one test. So of course, as long as it's negative, you get back you've got a negative result for all 30 animals. So if we're blood testing either young stock or beef cows, that's the most common way that I choose to do it because I think it's the cheapest. If you've got carriers in your herd, you'd be unlucky if you had more than one or two. So you might have one or two positive pools that you then have to go back and individually test those to find out which one it is. But most pools, you'll get a negative result and you've cleared 30 animals with one test. So yeah, there are lots of different ways. You can milk test, you can individually milk test, but that's not financially sensible looking for virus. So we tend to do the bulk milk test to look for virus, and then if you need to go and look for individual animals, if you've got a bulk milk test that's positive and you want to weed down who it is, you either take 3 bulk milk tests from the herd, if you like. So if you've got 300 cows, you have 100 contributing to each pot. People don't like that because you have to have a jug that you put a squirt from the first 100 cows and record who they are in order to be able to do that. So it's obviously fiddly. So what we're maybe more likely to do is to take bloods and pool them, like I've said, for the young stock. But there are lots of different ways of doing it, and it's really a case of finding, for each individual farm, it depends how many animals are involved and what the farmer would rather do as to which is the most sensible way to proceed. Some people want the cheapest and they don't mind how much effort it takes. Other people, want something that's going to be quick and are prepared to accept it might cost a bit more. But yeah, there are many ways of doing it. Anything else about BVD before we?
There's no way you can sample through your milk recording samples, then? So
Yes, you can. You can, but they'll only look for antibody. Now, antibody is what, like when the cow meets BVD, it produces antibody. Now, an animal that's a carrier, there are a few exceptions, but in number they're so small that you can ignore them. As a general rule, you can say that an animal that's a carrier is always antibody negative. So what you can do is you screen all your cows. Those that are positive for antibody, you say they can't be carriers, and then you have to blood sample the negative ones to find out if there are carriers amongst those. When I've done that in the past, I have ended up with, even in a herd that's highly infected with BVD, I've ended up with a lot of animals that test antibody negative, and I've had to go back and blood sample a large number of animals, only to discover that there are only 1 or 2 that are actually carriers. Yeah. So I used to do it that way, and I've now decided that actually it ends up more expensive because there are far too many animals that need to have a blood sample in addition to the milk sample. But you can do it that way. Anything else? No? Shall we move on to lepto? Who's got the leptos? Okay. Oh, I think that's yours. So, lepto, there are obviously many points relating to these diseases that we aren't going to cover, but I've tried to cover some of the important ones. There's a peeing cow, because in lepto, the most common route of infection is from the urine, because the cow's kidneys become infected. So the most common route of spread is from cow to cow via the urine, and obviously if they're out grazing, then they're passing urine on the grass that another cow's going to eat. So you can see how it can spread. Now, what is also really important for lepto is the fact that people can get it. So even without the animal implications, there are strong arguments for vaccinating purely to protect people. And the big risk area is particularly dairy cows in a herringbone parlour where people are in the pit milking. And so exposure to urine at that point is a very high risk. So it used to be a lot more common to come across people that had had lepto. It still happens, but it's much rarer now because more people will vaccinate. So in addition to the effects that it has on people, there are other ways that cows can come across it. One is co-grazing with sheep, so sheep are a risk. And another is through watercourses. So if you graze cattle where somebody else upstream has got cattle that are infected with lepto, they can contaminate the water and that can spread into your herd. Now, in terms of the effects that lepto produces in cattle, the biggest issues are reproductive ones. So it will produce, for a cow meeting it for the first time, it will produce a raised temperature, a decreased milk yield, for a few days. But often in herds where it's been established for a while, you don't often see those cows, but you'll much more frequently have reproductive problems. So you can have losses at any stage of pregnancy, but abortion is one of the main problems that would be associated with it. So the biggest arguments for vaccinating for lepto are the human health implications and the reproductive side for cattle.
Is it getting them in calf? No, it's just after they get into calf, right? But then
it can be either. It can be either. So it can be getting them in calf in that you genuinely can't get them in calf, or it can be that they lose an embryo very early And so what you see is a cow that you can't get in calf because it did, but it was lost before you were aware of it. So
Just like the sheep return.
yeah, yeah. And for some of those, what you'd say more commonly is that as a general rule, ones that were in calf and have lost it, perhaps return at an odd interval. Because obviously if they're never in calf, you'd expect them to return every 3 weeks. If they were pregnant and lost it, then you might have an extended interval. So if we see a herd with lots of odd intervals where people are serving cows, there are many reasons why that might be, but one of them would be that lepto is causing early losses. But it's much less obvious. If you have a herd that has never had it before and lepto gets in, you would expect to find a large number of abortions in pregnant cattle meeting it for the first time. If it's a herd that has been living with it for a while, you'll have some animals that have natural immunity and others that don't, and it moves around in a much more gradual way. And you don't have a storm of abortions, but you have occasional ones. And it is always difficult attributing an individual abortion to a particular infectious disease. So often an individual abortion, sometimes you'll test and you'll find the cause, but often you'll test and you won't find the cause. But there is a lot of evidence that herds with lepto will have abortion due to lepto. And if you control the lepto, of course you don't reduce your abortions to nil because other things might cause them, but you make a big impact on it. Okay? Anything else about lepto? Should we do yours? So the last one is Johne's or John's disease. And so this is your typical scouring cow with a thickened bit of gut, which is why the cow scours. The gut becomes thickened and it can't absorb the fluid and the nutrients. So the cow loses weight because she's not making use of what she's eating, and the dung is too loose because it's not being absorbed properly. Now, cows like this, which is what everyone thinks of as cows with Johne's, in most herds will be the tip of the iceberg, because these ones, for every one that's like this, you will have several more within the herd that are incubating the disease. Now, what we would encourage people to do is to establish the status of your herd if you haven't done already. Has anyone looked into the status or does anything for Johne's? You've got Johne's, okay.
Fine, like you can milk record for you.
Yep.
And we've got some that flag up on milk recording as being positive.
Yep.
You blood test them and they come back negative.
Yeah, the testing is difficult, so it's not like BVD, but the testing for BVD is really reliable, and if you test for BVD, you can be confident that that's a positive and the animal has got it. The testing for Johne's is more variable. What you tend to find is, as I say, we would get people to do these 30 cows to start with. So in order to establish what your status was, we'd get 30 cows tested. And in those 30 cows, you would pick animals that are most likely to have it. So you would pick anything that's thin, anything that's scouring. Because cows with Johne's are more likely to have mastitis or be lame, you would pick ones with those particular problems. Look at 30 animals and see if you've got any positive. If you find positive animals in amongst those, then you probably ought to be doing further testing to find out what proportion of the herd is a problem. And if you particularly want to control it, or if you have more than an odd one or two positive, then what we would encourage people to do is the scheme with your milk recording that you're talking about, where you do quarterly testing. So you sign up and every quarter they test all of the cows. Now obviously some cows might be dry for one of those times, so each cow might be tested 3 times. And when you do that and you get regular results for the same cow, you'll discover that some are, once they've gone very high, they tend to stay very high. But when they're in that intermediate sort of level, they will fluctuate, and some will fluctuate for longer than others. So you will get, I think, an animal that has ever tested positive needs to be considered to be at risk to others, but they won't stay, if they're in that medium sort of level, they won't stay positive all the time. So they will tend to fluctuate. But what you find is, do you know the story that they catch Johne's as baby calves?
No.
Yeah,
Because no farmer don't give their cows colostrum because it's all in the antibodies, but their cows don't do as well because it's powdered.
yeah. I mean, some milk is genuinely infected, like the actual milk, but what is more common is that it becomes contaminated with bacteria from the dung of the cow. And because the cow produces so many bacteria, like a bit of contamination on the udder, on the cow's leg, that gets into the milk is enough to make the milk infectious. So one way that we control it is to think about how we feed calves and to try and reduce that risk. Because the baby calves are the ones that are most susceptible. They pick it up, they carry it throughout their life, and if you tested them as young stock or young adults, in most instances, the test will be negative, but they're carrying it all the time. And the test becomes positive on average in the last 12-18 months before they start to show these symptoms. Now I say on average because there's a huge amount of variation. But what we're doing by regular testing is trying to identify which cows are infected before they get to the stage where they're infectious to others.
So if a cow's like that and has
Yeah.
a calf, but the cows have
Yonis.
Yoni, sorry. The cow has the same as
Yeah, the calf of a cow that's positive is highly likely to be positive. Now, a proportion of those are genuinely born positive because they catch it in the uterus, but that's a smaller proportion. The bigger proportion of them catch it from contamination from the environment after they're born. So obviously we can't do anything other than not keeping replacements from positive cows. We can't do anything to stop them becoming infected in the uterus, but we can do something about stopping them become infected afterwards. Now, if they're born to a positive cow, it is really difficult to try and stop that calf, that individual calf, becoming infected. And the way that you try to do it is that you snatch it from the cow at birth, and that literally means it mustn't touch the ground. So you need to be there at the point of calving with your wheelbarrow to put the calf in and wheel it away.
the cow can't even look at all.
No, because the environment is so contaminated, there's such a high risk. So obviously in most instances that's not practical, or at least very difficult, because you have to be there at that exact moment. But some people will do it for cows that are particularly important to them, that might be carrying a heifer calf that is particularly important to them, because it greatly reduces it doesn't make it zero, but it greatly reduces the risk of that calf being infected. So if you're testing regularly and you know which cows are positive, then you can put in place methods to try and reduce the infection rate in your calves. So one thing that you do is that every cow that tests positive, you assume that it's got the bacteria in its dung, and so you assume that it's going to contaminate the area where it calves. So it must not calve in an area where other cows are calving, because if it infects the area where they're calving, then all the other calves born into that area potentially become infected. So once you've identified positive cows, they mustn't calve in the same area as other animals, and their milk mustn't contribute to the feeding of other calves. So one issue is obviously that individual cow's calf, but if that cow's milk is contributing, and that's what that picture shows, if that cow's milk is contributing to the feeding of all of those calves, then you can have a whole batch of calves infected by the one cow that's gone in. So if you know the cows are positive, you can feed artificial milk. That's one way that people will do it. Another way that you get round it is slightly bigger risk than feeding powdered milk, but if you feed milk from cows that you know has tested negative, and especially if you're testing the cows every quarter, so you've got really up-to-date information.
How about if you pasteurise it?
Yeah, or you can pasteurise it. Yeah, that's another option as well. So there are lots of different ways that you can deal with this, and what we try to do is find a way that suits the farm in question. So different people will choose different options to try and overcome that risk. But you need to know who your risk cows are so that you can control them.
Well, wouldn't it just be easier to, when it says cull the cow?
Yeah,
Like
so
the high risking cow.
yeah, so you could.
Well,
Yeah, no, see, this is this picture, which is put to a beef calf.
That's a good Photoshop.
Sorry.
That's a good Photoshop.
Yeah, our vet student produced that for me yesterday. I was very pleased with it. So one option is, the thing is, if you've tested your animals, if you find that you've got one animal that's positive, well, that's easy. You can get rid of that one animal. But if you're repeatedly testing and lots of animals are coming up positive, you can't just be culling everything. So what we would say is that, because a lot of the time people were put off of doing anything about yonis because they were worried about how many they were going to have to cull. So what we're trying to encourage people now is that you don't necessarily have to cull them, but you need to manage them differently. So you identify which are your positive cows and you manage them differently. And as long as in themselves they're holding their condition and they're not scouring, they're showing no outward signs of yonis, then you can keep them within the herd as long as you manage them accordingly. And so it means that people can be doing something about yonis without culling lots of animals. The other thing that it means is that this cow, if she were positive, has got a great deal more value to her than this cow. So if you know who your positive cows are, you can be watching them, and what we'd encourage people to do is mark the positives in some way. Like some people put a red tag in their ear, some people put tape on them, so that everybody knows who the positive cows are. And in addition to the different ways in which you're going to manage them, you're also going to keep an eye on those animals' condition. And if they begin, because you know that they're positive and you know that it's going to happen at some point, you watch them, and when they start to lose condition, you get rid of them as a cull at that point where they've still got some value to them, rather than letting them become like that where they've got no value at all. So if all you did was test and cull and you didn't change the way that you manage things, you're unlikely to get on top of it. It's the regular testing and managing things differently that allows you to get on top of it. But unlike BVD, where if you chose to, you can eradicate it overnight and make a big difference, this is a long-term thing. Because what we're talking about is trying to reduce the infection rate in the next generation of calves. So if you start today and manage your calves differently, it's not until those animals are old enough to be in your herd that you're going to see any difference at all. So you're probably talking 4 or 5 years before you see any difference at all. So you've gone to all this effort and you've got to wait 5 years to see a benefit, and it's longer than that before you see a real reduction. And for many people, eradicating it is not practical, but you're trying to reduce its level to a more acceptable one. Okay?
Yeah, which cows can die young anyway?
Yes, often they do, and a high proportion of cows that are culled as normal culls from herds. So if they did a trial where they tested cull cows for yonis and then went back to the farmers and asked them why they culled those cows. And for the ones that were positive for yonis, it was very rare that the farmer culled them because he thought they had yonis. The farmer culled them because he couldn't get in calf because they had mastitis, because they were lame. And all of those things are more likely to happen in a yonis positive cow. So lots of cows leave herds because they have yonis, but nobody ever actually knows that that was what happened. There is a vaccine, but you need permission to use it, so it's not widely available. And it's really only applicable in herds with a really high level. There was somebody in one of the groups earlier who said that he was using it, but they had a third of their cows go down with yonis. And so clearly you have to do something a bit more dramatic than managing the feeding of your calves to be able to cope with those kind of losses. So they were given permission to use the vaccine, but permission would only be given in those situations. And to be honest, if what you're dealing with is like 4, 5, 6 cows, you can deal with that by managing them. So yes, it's a possibility, but it's not applicable for most people.